Hi, I'm Dr. Joy Lucas. I'm a board certified pediatric pulmonologist or lung specialist for kids. I'm an expert in children's asthma, and I teach kids and their families how to successfully treat asthma symptoms. And today I'm going to be giving you 5 tips, 5 secrets to fix your child's asthma symptoms. If your child has recently been diagnosed with asthma or they've had asthma for a while, you're still probably wondering, how did this happen and what can I do to make it better? So today I'm going to give you those 5 secrets to fix your child's asthma. Tip number 1, identify triggers for asthma symptoms and avoid them. Triggers are exposures that produce asthma symptoms, and triggers can be different for everybody. They can be any number of things: pollen, mold, dust, smoke exposure, viral illness. If you suspect your child has allergies, make sure they're allergy tested and the test is specific for your region. So you know during certain times of the year, to fall or the spring, if they're going to have worsened asthma symptoms because the allergens that they're susceptible to, ragweed or oak, are going to trigger their asthma symptoms. Keep in mind that strong odors from cleaning supplies, even perfumes, can trigger asthma symptoms for some kids. So be observant. If you notice that every time you mop the floor, your child has wheezing, that could be a trigger. So if you know that your child is triggered by certain things, avoid them. Tip number 2, if you have exercise-induced asthma, make sure you use albuterol pre-medication with exercise. What is pre-medication? You're simply using albuterol 2 puffs prior to activity. Albuterol works in 5 to 15 minutes to loosen the muscle that wraps around the airway and open the airway up, allowing you to breathe better. If you have exercise-induced asthma, taking albuterol pre-medication will allow you to function optimally when you're exercising and exercise for longer. Tip number 3, use a spacer device. A spacer device is a little tube that attaches to your asthma inhaler and allows for proper deposition of particles coming out of your asthma pump into your airway. Believe it or not, if you don't use a spacer device, 50 to 80% of the medication you take never makes it to the lungs. So make sure your child uses a spacer device every time when they're taking their asthma inhaler. Tip number 4, if you are a smoker, make sure you smoke outside. Vaping counts too. Make sure that you are vaping outside. Smoking and vaping are the most common triggers I find for asthma. If you are a smoker, consider quitting smoking. I know that's hard to do, but you can do it. Keep the faith. If you're smoking outside, wear a smoking jacket, put your hair up in a hat. If you have facial hair, wash your face after you smoke or change your shirt. All of that will help to prevent your child from being exposed to secondhand smoke that can lift off of your clothes, off of your hair, and really continue to be fuel for your child's asthma. Tip number 5, make sure you take your asthma medications consistently. If you have been prescribed a daily inhaled steroid, that's a medication that you take to control your asthma every day, usually twice a day. You need to take about 80% of the doses. So if you're supposed to take a medicine, if your child's supposed to take a medicine twice a day, that's 14 times in a week, you must take the medicine 11 out of the 14 times in order for it to effectively work, about 80% of the time. So make sure you take your medication consistently to fix your child's asthma symptoms. These 5 tips, these secrets will help you fix your child's asthma. If you found this helpful, please follow me on Instagram, Twitter, and Facebook at Dr.JoiMD. That's Dr.JoiMD. I'm Dr. Joy Lucas, a board-certified pediatric pulmonologist or lung specialist for kids, and I help kids and their parents successfully treat asthma symptoms. I have a new product coming out. It's called Asthma Kid Care Go Bag. You can go to my Facebook page to learn more. It's an asthma visit in a bag, and it helps you and your child organize your asthma medications and care plan. Thanks for watching.